I should just give you a whole 10 minutes because I had to cut you off and I mispronounced your name. But you know I won't be able to do that.
Thank you. So, my name is Linda Barton, and I am a registered nurse in the ICU at Norwood Hospital. And I thank you for the opportunity to speak to my concerns related to the draft regulations for the ICU staffing law. I would like to specifically address sections 8.01 and 8.06. Our ICU is a 10-bed mixed unit. Our staff is very experienced, dedicated, hardworking, caring, and we are a very cohesive group. And we do help each other all of the time. Each day we are faced with a full unit with patients on vents, vasopressors, sedation, patients withdrawn from alcohol, patients who are fresh post-ops or fresh from the cath lab, patients who have suffered a cardiac arrest and are on hypothermia protocol, patients who have overdosed either purposefully or accidentally, and all of these patients need nursing to frequently monitor and assess them. An acuity tool is a tool, but the nurses need to be doing the assessments. Our patients need to be turned every 2 hours to protect their fragile skin, and this speaks to the quality measures that you've spoken about. Quality measures to obtain them need nurses, need nursing staff to make sure that we can obtain those quality measures and reach the benchmarks. Most of our patients are completely dependent on the nursing staff to be bathed. Frequently, at least 2 nurses are required to do this, and sometimes more, because our patient population sometimes goes into the 300 and 400 and 500 pound range. Each day the expectation is that we take 2 patients. Although an acuity tool is being developed at Norwood Hospital, currently the new law is not considered at all. And I think this probably is statewide, and no matter what hospital you work at. If we have a patient who we really insist must receive full one-to-one nursing care, the only plan in place right now at my hospital is to move the most acceptable patient to the recovery room for nursing care. And none of us are very happy about that, but that's all we have right now. We simply don't have enough staff. And just yesterday, a nurse took a 3rd patient because the unit was so busy and there were 2 one-to-one nursing patients. And there was absolutely no other option. So she took a 3rd patient, which we're really distressed about. Patients are generally in the hospital for 24-hour nursing care. Yet nursing is constantly battered, berated, and bullied into doing more with less. We are the backbone of the patient care experience. Yet we only hear about how expensive we are and that we need to learn to get by with less staff. All the while we're asking, please, for more staff. And the law also addresses that. So even if we have enough nurses for the census and the acuity, we lack an aide. I know that people have spoken about this. We have no aide, we have no secretary. The pharmacy staff, which is mentioned in the law, is cut. So we're constantly looking for IV medications. We're calling them all the time. I need another bag of vasopressor. I need another bag of vasopressor because they cannot keep up either. The patients have many family members who rightly expect to be updated on a regular basis, who have many questions, and who may be very emotional about the condition of their loved one. They require nursing care as well, and that must be considered when making our staffing decisions. And in summary, we simply need more nurses, we need more aides, we need adequate ancillary help, we need a strong physician presence, which sometimes is lacking, and anything less than that I feel is very disrespectful to the patients and to the nursing profession. And in terms of the community hospital that has been brought up, community versus the teaching hospitals, there probably is more staff at the teaching hospitals, but at my hospital I would just say that we need to hire more help. And I think that anybody behind me would agree with that. We need the flexibility if they need to hire more per diems or increase the critical care float pool to be able to go up and down, as the census requires. And that's what the administration needs to do. And I thank you very much for the time. All by myself up here.
Linda, I'm going to